Hey there, it's Andre, the Impulsive Thinker, and today I have here uh, Dr. Russell Ramsay. He's a psychologist specializing in the assessment and psychosocial treatment of adult ADHD. And today I brought him in to talk about anxiety and ADHD, which is also a common comorbidity, or some people I like to call it coexisting with ADHD. And I'm very happy he provided his time to help us today. So thank you, Dr. Russell Ramsay.
Andre, thanks for having me. I'm looking forward to our talk today.
Do you mind just giving us a little bit of background of who you are, what your experience is? Because you are recognized as an expert in adult ADHD, and I've read a lot of your articles in Attitude magazines. And just give us a little bit of history of yourself and where we can find you.
Yeah, I'll start off with that. You can find me. My website is www.cbt number 4adhd.com. Now, sometimes people hear me say CBD and they get really excited, but it's CBT, Cognitive Behavioral Therapy for ADHD.com. And there's a contact form in there if you want to get in touch with me. And I'm pretty easy to find on the internet. In terms of how I ended up being asked to do a podcast like this, I won't start at the very beginning, but I arrived at the University of Pennsylvania in 1995 as a postdoctoral fellow in the Center for Cognitive Therapy, which is to cognitive behavioral therapy what the Grand Ole Opry is to country music, because it was Dr. Beck's clinic. I mean, there are other wonderful clinics from people influenced by Dr. Beck, and ADHD was not on my radar screen. I probably had all the same misconceptions as anybody else, but March 8th, 1999, Dr. Tony Rothstein, a noted psychiatrist in Philadelphia and faculty at Penn Medicine, got my name from somebody who thought we might be a good fit. He was looking for a psychologist, and we had a meeting, and he had started the Children's Hospital ADHD program in Philadelphia. And now he was an adult psychiatrist and head of the adult residency. And he said, in a nutshell, I can handle the medications, and we've got to come up with some diagnostic protocol, but need somebody to sort of formulate a behavioral treatment. And my line for us is everything interests both of us, and we can't say no to work. And that was our anniversary date for the start of the Penn Adult ADHD program. So I will say I'm dispositionally lazy because there were not a lot of people working on CBT for adult ADHD. So there wasn't that much literature to review, and anybody reading about it we were the first among the first people writing about it. So it was, I will never say peer review is easy to get published, but I think we and colleagues at other institutions came up with at least modified a CBT approach that has proven now to be an evidence-supported treatment. So here I am in the 25th year afterwards, having left Penn to go to my own solo virtual practice.
Well, that's interesting because I know Penn State, was it, or University?
Oh, I'm sure this is just like Harvard and Yale love it when you mix them up.
Well, I'm sorry, I'm kidding.
No, I'm kidding. Penn State University, the football juggernaut. That's Pennsylvania State University, the state university in the middle of the state. University of Pennsylvania is in the Ivy League and is located in Philadelphia. Common confusion.
Yeah, and it is a highly respected organization in the adult ADHD world. So I appreciate all your work you have done, because at that time, adult ADHD would have been a relatively started to get generally accepted, or wasn't it accepted back then?
It was early. It was early on. So like I said, not too much work done on CB or even the talk therapies. Medications building on the childhood data they had a pretty good starting point, but then the cognitive behavioral therapy, like we were working on it. Steve Safran at Harvard, now at the University of Miami, Mary Solanto, Alexander Philipson in the UK. I'm sorry, Alexander Philipson in Germany, Susie Young and Jessica Bramham in the UK, Margaret Weiss, a whole host of people.
All right, cool. So today I want to talk about anxiety. Do you mind starting off by just explaining what clinical anxiety looks like, or feels?
Right. I'll just use, because people say clinical depression. Really what we're talking about is a diagnosable anxiety disorder. So typically some of the more common ones, probably the most common one, and also probably the most common one coexisting with ADHD would be generalized anxiety disorder.
Okay.
And that is sort of akin to an anxious temperament. There's a worry about plausible things that could happen. It has been called the disorder of what if thinking. Yeah,
Oh,
flying
wow.
safe, but what if this? What if that? Running through potential plausible scenarios. They're statistically possible, but probably not very likely. Now, we can all do that a little bit, but this would be consistently blowing things out of proportion and then feeling the sensations of anxiety. Maybe it gets in the way of falling asleep at night because you're turning over on these things. You can't let
Right.
them go. Maybe some somatic physical symptoms like headaches, muscle tension, teeth grinding. Maybe worrying is hard work. It tires you out. So more mental fatigue and maybe getting a little short-tempered. Now, that's probably the most common one, at least most commonly studied. Some other typically, and that's probably the most common one, I won't run through in the same detail, but things like specific phobias, like fear of blood or fear of flying,
Mhm.
um, um,
Oh, I never
uh,
thought that that's related
social,
to
oh,
anxiety.
well, that's an anxiety disorder, just like so
Huh.
excessive social anxiety.
Huh.
Well, the phobia would be the fear of getting on the plane because it would crash. It could be a fear of a particular animal. That's like a
Yeah.
learned fear.
Yeah.
Panic attacks and panic disorder, out of the blue, overwhelming fight, flight,
Yeah.
hijack
I just never
that
put the
people
two
think,
together. So that wasn't
oh yeah,
a
yeah. Well,
connection
that's
for me. Like I never
well.
put phobia as a
I'm
associated to
glad that you
anxiety.
don't, because now
Yeah.
I can still have a job. If it was that easy, everybody would be doing it. So there's a whole class of anxiety, but the generalized one is typically, I mean, somebody with ADHD could have panic attacks,
Hmm.
but that's usually pretty discrete. They can both, and that's the thing about coexisting factors. Things can just happen to go together independently of one another. Just like somebody with ADHD could have diabetes.
Yep.
Now, I guess that'd be an empirical question whether there's any connection there, but sometimes things, just because things go together doesn't mean they're caused by each other.
Causation.
Yeah.
Yeah. Yeah.
Yeah. Correlation
Correlation.
does not mean causation. But anxiety runs neck and neck with depression in terms of the main coexisting emotional conditions, if you will. Even though I think anxiety usually nudges ahead in most studies. So it's a very relevant and timely topic.
So let's just talk about like a non-ADHD, not a neurotypical person.
Mhm.
How does anxiety behave in the brain? Like how does that become anxiety? Is there a certain process or is it just some sort of phobia or fear?
Well, it can have multiple causes. There can be things that are learned, like a phobia. Somebody has a bad experience getting attacked by a dog when they're
Yeah.
younger,
Okay.
and then you can have a fear of dogs, and maybe it can generalize to other, furry animals that bare their teeth. Um, Similarly, there may be things like a phobia where just looking at a plane and saying, I can't see how that stays in the air. It just looks, and it looks dangerous. And there can be a predisposition, a genetic
Yes.
predisposition where there are overactive. I mean, the amygdala is probably the center of the brain, the portion of the brain, I should say, most associated with anxiety and emotions, even though there's more complex networks going on. So there can be a predisposition. And then there are things in the environment, just like somebody might have a shy temperament, and that could grow into more social anxiety, excessive concern that other people will be critical, that can lead that person to excessively avoid social situations, like skipping a class where they're doing a
Yeah.
presentation, not eating at a restaurant, or putting themselves in any sort of quote unquote vulnerability for their worries.
So did I hear this correctly? So anxiety is actually rooted with the amygdala. So it kind of presents in a fight or flight response or
That
fawn.
that 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 is one of the
One of
main
them.
domains.
Okay.
It's the one that probably has the best PR, even though it's generally
Ah.
more complex networks in the brain.
Yeah.
Just like
Yeah.
even with the executive functions, you think
Hmm.
about the prefrontal cortex, even
Oh,
though it's
you're
more
right.
complex networks. Yeah,
Yeah. So the prefrontal cortex, if it's not, if it's deficient or we got our deficits, that's not there to filter if it's an
right,
actual problem or not.
right,
So it's,
right,
yeah,
right.
the two working together or not working together. Very interesting. So how does anxiety present with those with ADHD?
It It can present in many of the same ways because the body, once the anxiety system clicks, it can be the same like apprehension and maybe grinding on things. So apart from that sort of just random, maybe not random, but just coexistence side by side, I would make the contention that there are many aspects that go into anxiety. Typically, anxiety is associated with the themes of risk and vulnerability, or or fear. And now something within the anxiety literature that's emerging that I think helps better explain the ADHD anxiety connection is the role of intolerance of uncertainty. Because part of risk is, I know I'll probably be all right. Flying is the safest form of travel, but it's non-zero risk.
Yep.
There is a possibility the plane goes down, and you're welcome to anybody has a flight scheduled anytime soon, but it's very low and probably less likely in a country like the United States where there's regulations and things like that. But that intolerance of, yeah, but there's a possibility, and then it can get built up in the mind and going back and think about, well, there's a crash here a few years ago, crash there a few years ago, and it's getting distracted by the possibilities rather than the more likely probability. So that's how it can manifest. Now, with the intolerance of uncertainty, being pulled away by the possibility, the non-zero risk rather than the probability. My contention with ADHD and why there's such a high coexistence of ADHD and anxiety is ADHD, for my money, is an uncertainty generator. It is the consistent inconsistency. I know I can do it, but I don't know I will be able to make myself do it tomorrow at 2:00 when I plan to do it. Or I'm not sure if I'll be, I know I should study a few days before the midterm exam, but I'm not 100% sure. I've done it sometimes, but I'm not exactly sure I'll be able to do it tomorrow when I plan to do it.
Dude, like,
and there's some emerging evidence about the role of intolerance of uncertainty with anxiety and ADHD. Very preliminary, but it's supporting this hypothesis.
You need to keep me in touch with that kind of information, because like that's huge. Like, I don't know, when ADHD is uncertainty generator, is it an uncertainty generator?
Or another word I've used is an entropy generator disorder. Yeah. Because it's from the consistent inconsistency with ADHD. And I've talked elsewhere about the main cognitive theme, at least my proposal, and this is based on anecdotal evidence. It's a hypothesis to be studied, but the main cognitive theme is that of self-mistrust. I know I can do it, but I don't know if I will do it, said uncharacteristically, succinctly by me.
Yeah, it's not a problem of what we don't know. We know what to do. It's when we don't do it. Yeah.
I could speak loudly and slowly and tell somebody I'll tell clients, if we're talking about procrastination and the only thing I bring to the table is, you know what, you need to start earlier, please pay on the way out. Sue me for malpractice, please.
Right.
Because that everybody knows it. It's a performance problem, not a knowledge problem. And that's been said by others before. So I'm just building on that.
Yeah. And I read that on your website, and yeah, it's a performance problem, but yet it's measured against someone else's measuring stick. Like, we can still perform. It's just not normal or consistent. Right. And I love this.
We could use the word inefficient, or and
it's all perspective.
When there's a deadline or hyper focus, that's almost like you could beat anybody else in that race when it's hyper focus, but it's a very delicate stage to reach, and it comes at a cost.
Yeah, where they're all in or not. All in or all out.
Right.
And now hyper focus means we're all in, we can get the stuff done. And if we're all out, man, that's very difficult.
Right.
I just want to repeat some of these phrases here. ADHD is an uncertainty generator, consistent inconsistency with ADHD. And I really like the term, the self-mistrust, because of this. I've never put it in regards to that. And now I'm starting to see how the anxiety can be created.
Right.
So,
well, you know what? And go ahead.
No, you go first.
No, I was going to say, and the whole hypothesis about the self-mistrust, and this is self-serving in a way, but it was in the most recent book, Rethinking Adult ADHD. And that really focuses on the cognitive piece of the cognitive behavioral therapy for adult ADHD. And in my forthcoming book, the CBT workbook for adult ADHD and anxiety, again, these are not official things. So I don't want to put it out there that, okay, here are some new diagnostic categories. These are just helpful categories for experience in terms of one of the ways that ADHD manifests differently for adults with ADHD when there's not that official diagnosis, because something like generalized anxiety, probably the most common one, there are some boxes that need to be ticked. For at least 6 months, somebody has experienced relatively persistent anxiety, excessive worry about things, even though they know it's out of proportion to the actual likelihood, interfering with sleep, increased agitation, somatic symptoms, all the things I mentioned before. And a lot of people I'm sitting across from, they say, well, when the midterm's over, I'm chill, I'm fine. Or the weekend home from work or more extended periods, if it's summer break or spring break, I'm not worried about anything. It's very task related. So one form of anxiety I've heard people describe, and it's not actually necessarily describing fear or risk, but it's the overwhelm anxiety. I am just anxious by everything I have to do, the whole pile of everything. And I'm feeling flush, and they're not having a panic attack. They're not fit in any category. It's not like a airline flying phobia, but it's that discomfort, the ugh feeling is like overwhelmed with, I don't know where to start. And that uncertainty. There's also, because we think about, okay, how do you deal with that? Have a plan, break it down into itemized things, but there can be a planning anxiety because for many individuals with ADHD, looking at things even for a day, and there may be a history of, I make great plans, but I don't follow it. So in a way, part of the thinking and the emotional reaction is, okay, I got a plan for tomorrow, but this is my recipe for failure, potentially. And so the thought of doing it, something that everyone would say, have a plan, which is not wrong, but there's another layer. Now this gets to it's not a knowledge problem, it is a performance problem. There is the whole therapeutic behavioral thing of, well, how do we make sure the plan is realistic and that you can do it? And let's focus on breaking down each task. So that's part of the cognitive behavioral therapy approach, but it can start with, I feel better, I'm just going to wing it because that's safer. But winging it, there's evidence from neurotypicals as well, that is a high cognitive demand task because there is also what's known as choice fatigue, deciding what to do. And I hate making us sound like in this 21st century world, like we're these delicate flowers, but you know what, we're not dealing with polio or anything these days. So now we have the opportunity, but deciding what to do. And just like with multitasking, every switch is a cognitive load, draws on the cognitive system, which is fatiguing. So winging it sounds good because you don't have to worry about having the plan, but then you're most likely not going to feel like doing anything that elicits a little discomfort or anxiety, like homework or whatever. You'll do the safer things first as part of our natural wiring. Of course, we don't want to put ourselves in that situation, even if we know logically it's getting in the way of that longer term goal, catching up with homework, preparing for the test, preparing taxes, whatever it is we have to do. So those are just a couple of the ADHD related
and that makes sense. And what I usually explain to people is to me, it's more about mental energy management. So, which is, it's in a different way. It is a cognitive load, emotional load, and my habits and routines actually reduces my cognitive loads. So I don't have to waste that energy because it's finite. And if it's not used efficiently, it burns out very, very quickly.
Right. The fancy phrase is pre-commitment, making a plan. And also with breaking down tasks, if you want to impress your friends, the terms are event segmentation and sequencing.
Right.
So, so no, you're spot on with that.
Well, wow, man. These are some really great phrases here that just completely opens it up. So the one thing I never felt myself had general anxiety. I didn't have this what if thinking disorder, as you called it, but I did discover pre-diagnosis about 7 years ago, or whatever my math is. I can't do it in my head, even though I'm an engineer. I was always an anxious person. So I don't know if it was my physical hyperactivity or just always have to be on the go, go, go. But everyone says I was always anxious, not anxiety. Is that a difference there, or is it similar?
It's something with anxiety. There can be more agitation
Okay.
because when we think about what the fight flight system does, and it's not the only system, there's the freeze faint system. And
Hmm.
there was some research saying that identified women might be more prone to tend and befriend, like rely on
Yeah.
social systems but the fight flight system is about action. So there can be
Uh,
that overlap. Um,
it's
and
about,
and
yeah.
also if there's hyperactivity. So this is why um, you know, and like with difficulties turning off the brain to fall asleep, that could be from somebody's worries, but it could also be
Yeah.
from somebody. I've heard people say, I'm not worried, I'm just going over things in my head, but it keeps me awake enough. And
Hmm.
now, and these things again can coexist. So there is some overlap, and it's probably why many people may, and particularly women, but men as well, might end up going into some form of treatment, be it medication or therapy for anxiety first.
Hmm.
But also, the anxiety can be about, like you said, the hyperactivity. And when we think about the use of the word anxious, sometimes it can be used for positive anticipation. I'm
Yeah.
anxious for the weekend, or I'm anxious for vacation. I'm looking forward to it positively. But it's energizing, and even then it can be hard. You know what it's like a Friday before a long weekend. It's hard to
Hmm.
focus for a lot of people because you're thinking you really don't want to do work because you want to get to the weekend, but you have to show up and do work. So it can take a lot of different forms, but that's why like the hyperactivity with it can look like anxiety, but it may not come along with that, like
Right.
the uncertainty or the fear and the risk.
I think that the one key thing you said there, I think the listeners need to be aware of, and I'm going to repeat it, is like what I heard was anxiety is actually energy draining, or
It can
negative
be. Well, it's
negative
wearing.
anxiety is energy draining, but a positive anxiety is energizing. Or
Well, it's energizing, but it can be draining too when all is said and done.
yeah,
But usually, if it's focused like in a positive way, there's at least some. I mean, eventually,
yeah.
any of us can tire out.
Hmm.
But then, if it's something we enjoy, it can also be energizing. But fight flight system, when we think about it, we just want to get to safety or fight off the predator or whatever, the attacker, whatever
Yeah.
it is. And then there's a big letdown, and it can be really really
Yeah.
tiring
And I
and
think
hard to
that's a
rebound
great
from.
insight and a good thing you said. Fight or flight systems about action. I never put those two
Yes.
together, and that makes a lot of
Right.
sense.
Right.
Either it's physical action or even
Right. Well,
verbal,
this is,
even.
this is all part of the emotional regulation piece.
Yeah.
It's the emotional labeling and understanding like the themes like of the different emotions. So like I said about anxiety, it's risk and uncertainty,
Hmm.
perception of risk at least. You know, we
Yes.
we sit we see
Keyword.
the snake in the yard, but it ends up being the garden hose. But we're hardwired to say, err on the side of thinking the garden hose is a snake, not the reverse.
Yeah.
The feeling, I know this is beyond what we're talking about, but the theme of depression is loss. And that could be the
Yeah.
actual loss like you have in grief, but it could also be the loss of an opportunity, the loss
Hmm.
of a partner, loss of a job by the interview not going well, things like that. So that's a part of the emotional regulation strategies in CBT, and also normalizing this sometimes.
Yeah.
Nobody in their right mind wants to do homework, even really good
Yeah.
students. People aren't on summer break like emailing the college saying, can you assign me some work? I'm really missing that. So it is effortful. And that's why for anxiety, the main treatments for classic anxiety are generally exposure based,
Right.
incrementally facing the avoided task or
Right.
situation. And in a way, boring yourself out of the anxiety. It's like watching a scary movie
Hmm.
over and over again until it may be a wonderful, scary movie, but it won't make you jump the exact same way.
Oh,
But
cool.
with ADHD, that's like a lot of our want to and have to tasks become associated with this is going to be hard. This is going to be awful. It's going to be twice as long for half as much, as a colleague once said. And this can be rooted in reality,
Hmm.
where it is somebody's past experience. No, I have spent twice as long as any of my classmates on an essay, and I still got back that I failed or I had to redo it or something like that. So these are like, it's like the dog attack. These are based on learned experiences where that's part of the change process and using the ADHD coping skills.
Oh, cool. So we're running out of time here, but one last thing I think I want to talk about for sure is a lot of times we hear the anxiety is diagnosed first and they try to treat that, but nothing really happens. And then the person's discovered at ADHD and then they treat the ADHD, then the anxiety reduces or disappears. Can you speak more to that? If why is it treating the ADHD will help with anxiety?
I would imagine there's some cases like, so I'm dispositionally, I have to challenge any all or nothing thought. So I'm sure there's some cases like somebody's having really bad panic attacks where they can't get to work or school with some agoraphobia, where yes, just like if somebody's suicidally depressed, even if ADHD is causing it, that should be the first thing. But it
Right.
doesn't mean we ignore the ADHD or it's not important. But I think this goes back to ADHD being the uncertainty generator and thereby the anxiety generator. If you treat ADHD effectively, medications, the psychosocial treatment, some combination, very often people say, if I feel more confident in my ability to be on time, to get started on things sooner, more often, never 100%, but more often where I feel less behind and more up to date, surprise, surprise, without any anxiety medications, the anxiety goes down, the confidence, comes up. So in some ways it makes perfect sense. And in some cases, like even just the stimulants alone, which can rev up things. And it's something the prescribers will monitor, but we would say that's counterintuitive because if this person's anxious, but if it helps you focus where you feel more confident with what you're doing, anxiety will come down.
Because now we're able to process it and think a
Because
little
you're
more
able to
slower.
process, you're on top of things and you're getting more positive feedback. So we're feeling better and more confident.
Well, this is phenomenal. I learned a lot of great things here. So I appreciate your knowledge here. And the way you communicate is very effective.
Oh, thank you.
And like anxiety is an intolerance of uncertainty, like huge. This is my big one. ADHD is an uncertainty generator and also an anxiety generator. So because we're consistently inconsistent, that causes us more uncertainty. And since our mind doesn't stop and can contemplate 200 different things at once, I can see how that amplifies it up.
Right, right. And that can be overwhelming too. How do you choose one or two things out of the 200?
Yeah, you're right. It's overwhelm. And I never really thought of overwhelm can cause anxiety. I
That's
never thought of that.
I may not be using like anxiety in terms, but that's usually how it comes up. And then like at least how and again, I'm just using that in the forthcoming book. And we could also think about it in some ways, ADHD is a performance anxiety. It's not like being afraid to play an instrument in front of other people, but it's the implementation anxiety about, I know I can do it, but I don't know if I will do it when I have to. And there is a public facing side of ADHD. If you don't hand in homework, you hear it from the teacher. If you're not prepared from the meeting, you hear it from the boss or coworkers. So some things are private. Nobody's going to know if I don't do my documentation today, but later on, if I don't get it done in time, if there's any sort of oversight, then I'll hear about it and other people will know. And that's where I know this is different than anxiety, but that's where the guilt and shame can come up. Other emotions.
And I think, sir, that's exactly what the episode takeaway is all about. The anxiety is not necessarily about the what if thinking or the perception of risk. It could be a lot of performance based anxiety created because of our consistent inconsistency performance.
Right. That's my contention. Yes.
Wow. And I think a lot of us can relate to that. So thank you very much. And for you, the listener, I ask you, do you find you are consistently inconsistent? And does that cause you a little bit of anxiety? Russ, I appreciate your time here and great discussion. I know I learned a lot and I know everyone here did too. So, and thank you for your work in the past.
Well, thanks for giving me a forum to discuss some of this with you. Thank you.
All right. And for you, the listeners, we'll talk to you soon.